Welcome to Tech for Good with Bethnal Green Ventures. My name is Paul Miller, and I'm delighted to be joined today by Rebecca Allam, co-founder and CEO of PreActiv. Hello, Bex.
Hi, Paul. Thanks for having me.
No problem. So, first of all, tell us a bit about PreActiv. What does PreActiv do, and why is that important?
Sure, of course. So, PreActiv essentially is a digital platform that harnesses technology to create individualized prehabilitation programs based on patient health data to prepare them for surgery. And it's really around optimizing patients so that they have the best outcomes after surgery, reducing the risk of complications, shortening their hospital stay, and getting them back home as quickly as possible and recovering as quickly as possible. And it's very much a focus on preventative medicine, and trying to be more proactive rather than reactive, which classically our health system tends to focus on, but there is definitely more of a focus on preventative medicine now.
So, yeah, tell us a bit about yourself, because there's obviously there's a backstory about this, isn't there, in terms of like how you came to it. But also tell us a little bit about, when you were younger, did you think you were going to start a business like this? Did you ever think of yourself as a future entrepreneur when you were starting out?
Sure. So my background, I'm a doctor by background. So I was a hematologist. I was in my last year just before becoming a consultant. So lots of people are always surprised that I stepped away from medicine at kind of that last hurdle. I've been working in the NHS for over a decade at that point. And then if you add, I guess, med school, integrated degrees on top of that, that's another 6 years of training, in addition to that kind of 10 years in the NHS. And I guess part of it was there was a real frustration in that I went into medicine because I wanted to, I know it sounds generic, help people make a difference. And although you can definitely, you're definitely doing that in your day-to-day job, to roll out a wider change and a real change within the systems within the NHS is really quite difficult. And that's where I started to notice that actually applying a business model to it rather than doing quality improvement projects after quality improvement project that you then move around to a different hospital and it gets forgotten and nothing actually changes, or you might be really fortunate and sort of instigate a change in one trust, but that's not across the whole UK. We sort of really identified that a business model with a double bottom line of, making it profitable so that you can build more, innovate more, but also having a social impact and a lasting impact for the population was kind of the way that we could make a bigger change. And that's kind of how we ended up going down a business route. And then the other part of your question is, did I ever think I was going to go into business? So I think when I was younger, my parents sort of steered me away from it,
Right.
for more of a kind of secure line of work where they
Yep.
were very much about going to university for a vocation. And I think my mum's dad had some unfortunate times in business and sort of meant that she was not very keen on us going into business either as the children. Um, but I did do business studies as an AS, and so did quite well in it. And then I dropped it. And my business studies teacher at the time was like, apparently he said to the rest of the class, that's the loss of a great business mind, which is which I think is very, very nice kind of him to say. I'd love to be able to tell him now that I've come back round. But I just focused on medicine at the time, rather than business, and didn't kind of went for more of a traditional career approach. But it's really exciting. It's so different from medicine. It's got these
Mm.
huge up and downs. It's a bit more of a roller coaster, I would say. But it's really exciting as well.
Was there sort of, particular things that inspired? I mean, you to start PreActiv. You said we should say that we as you
Yeah.
and Alec.
Yeah.
What was it that inspired you to start PreActiv? Were there sort of particular examples you saw, or was it more looking at
Yeah.
I guess, the stats and the sort of the policy side of things?
Yeah, no, it was definitely from experiences. And I think that's what really builds that kind of passion to want to make a change. So from my point of view, I was sitting across from patients who were often oncology patients that were about to undergo really toxic chemotherapy and were very underprepared. And from Alec's point of view, so he's an anaesthetist and a consultant intensive care physician, and he would sit across from patients about to undergo surgery in a similar situation. And often these patients were really underprepared. There was nothing we were really giving patients. It was just eat well, exercise, and don't worry, we'll kind of look after you. But actually, these patients then ended up having horrible complications that really impacted their long-term quality of life. And you take cardiac surgery, for example, elective cardiac surgery, 1 in 100 patients will die from that procedure. Yet sort of, that's a huge proportion, yet there's very little preparation. And then it was that stemming, so that was kind of like our experience. Alec also had like a personal experience that his father was diagnosed with cancer and had several pretty horrible complications as a result of his treatment, and was that classic patient who was diabetic, high blood pressure, a little bit overweight, and didn't optimize himself at all, and unfortunately came away with these complications, and unfortunately passed away from his disease in the end. So that was kind of the heart of why we wanted to make a difference and do it. And then the
Mm.
second part was we're doing these quality improvement projects. Both of us are quite, committed to trying to make a change for our patients in the hospitals that we work in, and then seeing that we'd move on to another hospital and it would get dropped, or we were in one hospital and you make a difference there but it's not rolled out to the next hospital. So that's that kind of applying that business model to make a much wider spread change, really kind of inspired us to take that leap.
Yeah. I think people will have obviously heard of rehabilitation, but can you explain a little bit of the science behind prehabilitation and how you're trying to sort of encourage that with PreActiv?
Yes, of course. So prehabilitation is a newer concept. So there's kind of been more and more evidence coming out about it, and especially from the UK, is sort of one of the countries that has really sort of created a lot of that evidence base, which shows that optimizing patients before surgery makes a massive impact. So that is trying to improve patients' anaerobic threshold, their VO2 max, and their functional status before surgery. And if you think about it, when you undergo surgery, that's a huge stress on your body. One, when you have the surgery, and in that post-operative period, you have a lot of, sort of an inflammatory phase afterwards where you can have complications as well. And the same with sort of chemotherapy. And actually, if you prepare yourself and improve your cardio, respiratory fitness and your muscle bulk beforehand, you can really cope with that stress of surgery a lot better and also recover from your complications a lot quicker. So there's some fantastic evidence that's come out showing that it can reduce your risk of complications by half. And when you put that in context, approximately 30% of patients undergoing major surgery will suffer a complication. So it's quite a large chunk. And each of those complications on average costs £10,800 in additional bed days, the care that's required. So there's also a cash saving benefit for trusts as well. And on top of that, even if you have a complication and even if you don't have a complication, it can reduce the length of bed stays, the length of stay that you're in the hospital for. So from patients, that's great. You get back to your loved ones quicker and back to sort of your everyday activities quicker. And from a hospital point of view, it frees up bed days to get more elective surgery in and reducing those wait lists that are so huge at the moment. And as well as releasing some cash as well, and helping with cost savings by increasing that elective capacity and the amount of cost spent on complications.
Yep. So it stops you going back again.
Yeah. Yeah.
Yep. And tell us a bit about PreActiv. So what have you built so far, and what's the patient's experience of it?
Yeah, of course. So we have a digital platform that's accessible on any device. It builds a bespoke program based on the patient's health data, fitness, mobility, frailty, and creates a program that's suitable for them. And then it adapts. So, which is the really exciting bit. So it adapts after every session in line with their feedback, exercise tests. So really adapting to the progress of that patient. And that's just the exercise component. There's then interactive modules on nutrition, mental well-being, pain management, and the other really fantastic thing is it's built to surgery and treatment dates, which is quite unusual. Most of the programs that are available and that are out there are like sort of set, here's your 8 weeks of prehabilitation. But we know, on average, total knee replacement will wait 4.5 months for surgery. So you're not really optimizing all of that, you're not using all of that time to optimize. So we really wanted to try and focus on maximum benefit for the patient and then maximum benefit for the hospitals as well. And then it transitions into tailored rehabilitation as well to help that recovery process. And then beyond that, we seem to be doing quite a few other projects as well. So we've got our prehabilitation for elective surgery, which for non-cancer elective surgery into rehabilitation. We have perihabilitation for oncology patients. So that's it's built to whatever treatment that they're having. And then we have a falls prevention program being launched at the moment. And we also have exercise programs in chronic illness and as well as programs for palliative care. So really looking at improving quality of life rather than sort of reductions in complications.
Yep. That's great. And what's the long term goal for PreActiv? Do you have an idea about the sort of the impact that you want to have and the kind of company that you want to build?
Yeah, definitely. So I think our real like sort of core company goal is to change the narrative of the NHS away from sort of reactive to proactive medicine, and there is so much more focus on that now about preventative medicine and not putting a plaster on and preparing before that. So I think sort of increasing awareness around preventative medicine, opening it up across the UK, and then looking further afield to sort of other global, sort of other countries as well, and globalizing it. And then additionally is that the kind of we have quite a core focus on promoting families and parents and flexible working hours. As a mum of three myself, I'm very pro, giving opportunities to other women in tech. It's a daunting space sometimes,
Yeah.
and trying to create that environment that women and dads can really thrive in.
Yeah, that's amazing. And then I suppose that brings us to what do you enjoy about running a tech for good venture?
Yeah, definitely. So I think one having that larger impact. So it's always so lovely having the patient feedback. That's one of my absolute favorite things when it's made a real impact to someone. One, and two, when you see the long-term behavioral change, when they're like, actually, I just want to continue this long term. Like, how fantastic is that? And especially when you're taking that into context of often that's an 80-year-old patient who hasn't potentially exercised or looked at their kind of nutrition for a long, sometimes 30 years. And actually, they come to us quite daunted because we focus on HIT style prehabilitation, specifically trying to focus on that anaerobic threshold, VO2 max, and functional status. And that's quite a daunting thing to hear that you're about to do high intensity interval training when you're 80. And we did a big focus on making it really enjoyable as well. So we've integrated like sort of gamification, for example, to make it fun because people just won't do it otherwise. So might as well, make it something that people want to integrate as part of their life. So that's really fantastic. We recently had a comment from one of our patients, Nancy, who said her surgeon had said to her the fastest ever discharge after surgery that they'd had was a 50-year-old at 48 hours, and she got discharged at 71 under 48 hours. So she was super, super chuffed with that. So yeah, that really helps, I think, make it all worthwhile and really is very rewarding.
Mm.
And then beyond that is, making this wider impact. And it's so exciting to think that there's so much more focus on prehabilitation now, with
Mm.
the perioperative care guidelines from the Centre for Perioperative Care that came out in last year, with a real focus on that patients should have prehabilitation, has really shone a light on it. And now trusts are actively looking to incorporate it. So yeah, it's an exciting time. And then lastly is really making that enjoyable workspace that's very supportive, and that everyone can bring their best to.
Yeah, that's amazing. And I guess on the flip side, what don't you enjoy, or what do you find? What do you find more difficult? I mean, I always wonder this. I mean, we've backed actually quite a number of founders who've previously been doctors, and I always think like being a doctor is a really really tough thing. But some of them always say actually there's some bits of running a venture that are harder.
Yeah, I would completely agree with that. I would say people ask me this question all the time, and I always say running a startup is like a roller coaster. You have these days that you're like, oh my gosh, this is fantastic. We've won this award. We've got this grant funding. We've got these contracts coming through, and it's so exciting. And then you have the down days where you're like, oh my gosh, our burn rate is this, our runway is this, what do we need to do? So there's never a dull day. Whereas I would say medicine, yes, it's stressful and it's busy and you're often understaffed. And so it's kind of like this more constant level, but it's more predictable. There's definitely a degree of unpredictable with startup life, which can be challenging. But there's so many positives as well. Like there's such a breadth of knowledge that you kind of tap into, and learning that you tap in. I feel like we're learning constantly
Mm.
new skills, and I have to say it's fantastic for family life, because before I had really rigid shifts, nights, weekends. I would miss my children all the time, whereas I'm quite happy working really late, so I can sort of flex my hours. But I work more than I was in medicine, but I get to go to the moments that are really important with my children, which means a lot.
That's really interesting. And so, yeah, what advice would you give to somebody who's starting their own tech for good venture? You're a few years into this now, and what would be your advice? And yeah, imagine somebody who was in your shoes a few years back.
Yeah. So make sure you are building a solution for a real problem. That's a real problem for the NHS. So the NHS is, as everyone knows, a tricky customer to sell into. It is challenging, but once you get a product in, and it is sticky as well, and the NHS is looking to innovate and improve. Um, so one, make sure your solution, there's real product market fit there. Two, make sure you have PPIE and early, so patient and public involvement, early, and so many rounds of user testing to have an iterative approach. Be ready to pivot quickly if you're finding something isn't really suiting the needs for either the hospital stakeholders or the patients themselves. Don't just think that you've sunken your costs and you've got to stick with sort of the original plan. I would definitely say if you're going into health tech, you need evidence. So we're really strong believers in evidence-based medicine. We It takes longer to get going, but it's worth it. If you invest in doing proper clinical trials, then you've got the robust evidence, and that is what the NHS is looking for, and that's what we look for as when we were clinicians, is strong evidence base. So make sure you have that from sort of day zero or planning towards it, and then incorporating it long term. So you're always looking at the health economics, making sure you're proving your ROIs is really important as well. Otherwise, you'll do a pilot somewhere. If you can't prove your ROIs, it's very difficult to build a business case. And although I believe it should be very much about patient experience, satisfaction, improving outcomes, if you do not build in that you are cost saving in this environment at the moment, it will be incredibly difficult to have your solution adopted. Sorry, that was a lot.
You've got lots of advice. It's great.
So much advice.
Been learning lots of things. It's brilliant. Brilliant. Well, Bex, thank you so much for joining us today. There's, real nuggets in there. That's fantastic. Thank you very much.
Well, thank you for having me.
Well, if you have suggestions for guests or topics we should be covering on Tech for Good, do get in touch. And if you're thinking of starting a Tech for Good venture and are looking for investment, don't forget to check out bethnalgreenventures.com to see whether we might be able to help. That's it for this week. Thanks for listening and goodbye.